What happens when a patient that's on hospice falls and fractures a hip? Good question, because we all know that falls can sometimes be the demise of elders, that they just can't come back from a severe fall or a hip fracture. And so, what happens when a patient is already on hospice and that happens? And generally, the goal is always the same. We want to keep that patient comfortable. And oftentimes it comes down to a discussion with the family and the patient. Do they want to be taken to the hospital with consideration of actual surgery? And some people may want to do that if they have fewer underlying health problems and still are early in their hospice path. So that is possible sometimes. They come off of hospice care, go to the emergency room, and complete their hip pinning or replacement surgery. Oftentimes, we do get patients back from the hospital that have attempted that kind of surgery and not done well, and then they come right back on hospice. Remember that this is not something that would be managed under Medicare hospice. The patient would have to come off of hospice care to go to the hospital and have like surgical intervention. Okay, so what happens to those patients that fall and we think that it might be a fracture of the hip? We're not going to send them to the hospital to get an x-ray and to verify. We're going to gently get them back into bed, and we're going to treat their pain. We use log rolling techniques, of course, to make them as comfortable as possible whenever they're moved. But oftentimes, patients and families will decide not to provide any kind of invasive diagnostics or care, but just make sure that patient is carefully and completely cared for with comfortable bed care. Really appreciate you asking. Keep those questions coming. I'm Nancy, one of the Hospice Care Queens from the Hospice Care Plan. Please go to our website, the Hospice Care Plan, and send in those YouTube questions after you watch all of our videos. Thanks.